Acid reflux, the silent troublemaker, and how to defeat it at home. Health Decode. Welcome to Health Decode. Do you often experience uncomfortable burning sensations in your chest, a sudden sour taste rising into your throat, or other fussy digestive issues? It's very likely that you're facing a silent troublemaker called gastroesophageal reflux disease GERD. Don't worry. Today, Health Decode will help you understand more about this uncomfortable condition, its causes, and especially the simple tricks you can apply right at home to defeat this troublemaker, bringing peace to your digestive system. Let's explore these secrets together. What is gastroesophageal reflux disease, GERD? Imagine your digestive tract as a one-way street where food travels from your mouth down to your stomach, where strong acid helps digest it. At the end of the esophagus, where it meets the stomach, there's a special gate called the lower esophageal sphincter les. Normally, this gate closes tightly after food passes through to prevent stomach acid from messily flowing back up into the esophagus. However, when the les weakens or doesn't close properly, naughty stomach acid can find its way back up into the esophagus. The lining of the esophagus is much more delicate than the stomach lining, which is designed to withstand acid. Therefore, frequent invasion by acid can cause irritation, inflammation, and lead to the uncomfortable symptoms we call gastroesophageal reflux disease GERD. The masterminds behind acid reflux. Many factors can contribute to the rebellion of stomach acid and cause GERD. Identifying these masterminds will help you take more effective preventive and coping measures. Loose lower esophageal sphincter les. This is the main cause. The les can be weakened by various factors. Hiatal hernia. When the upper part of the stomach hides above the diaphragm, the muscle separating the chest and abdomen, it can weaken the LES. Overloaded pressure on the abdomen. Being overweight or obese and pregnancy can put significant pressure on the stomach, pushing acid back up. Harmful eating habits. Eating too much, eating too quickly, and lying down immediately after eating all create conditions for acid to climb up. Food and drink accomplices. Certain foods and drinks like fatty and spicy foods, chocolate, mint, coffee, alcohol, carbonated drinks, citrus fruits, and tomatoes can stimulate acid production or relax the les. The accomplice called tobacco. Nicotine in tobacco weakens the LES. Hidden culprit medications. Some medications like aspirin and ibuprofen can irritate the stomach and increase the risk of reflux. Identifying the uncomfortable symptoms of GERD. GERD can manifest with various symptoms, from mild to severe, significantly affecting your quality of life. Heartburn, a burning sensation spreading from the stomach up the chest and possibly reaching the throat. This is the most typical symptom. Regurgitation, the feeling of sour or bitter tasting acid or food flowing back up into the mouth. Difficulty swallowing. Dysphagia, a feeling of food getting stuck when swallowing. A feeling of a lump in the throat. Globus sensation. Chest pain, can sometimes be mistaken for heart pain. Chronic cough, especially at night. Hoarseness, due to acid irritating the vocal cords. Recurrent sore throat. Bad breath. Tooth enamel erosion, due to acid contact with teeth. Secret tactics to defeat acid reflux right at home. The good news is that with simple changes in lifestyle and diet, you can absolutely control and significantly reduce acid reflux symptoms at home. 1. Changing strategies for your diet. Blacklisting problematic foods. Identify and minimize the foods and drinks you notice cause or worsen your symptoms. Fatty foods, spicy foods, chocolate, mint, coffee, alcohol, carbonated drinks, citrus fruits, tomatoes. Dividing forces. Instead of eating 3 large meals, eat several smaller meals throughout the day to reduce pressure on the stomach. Eat slowly, digest well. Eating slowly and chewing food thoroughly helps the stomach digest more easily. Drink water at the right time. Drink enough water throughout the day, but limit excessive drinking during meals to avoid diluting digestive juices. 2. Adjusting tactics in daily life. No rushing after meals. Avoid lying down or vigorous activity immediately after eating. Wait at least 2 to 3 hours. Strengthening defenses. Elevate the head of your bed by about 15 to 20 centimeters when sleeping to take advantage of gravity and prevent acid reflux. Relieving pressure. If you are overweight or obese, losing weight will help reduce pressure on your abdomen. Say no to smoke. Quit smoking to improve the function of the LES. Choosing comfortable clothing. Avoid wearing tight clothing around your abdomen. 3. Secret tactics from the herbal garden. Consult a professional. Some herbal teas may help soothe mild reflux symptoms. Ginger tea has anti-inflammatory effects and soothes the stomach. Chamomile tea may help relax and reduce inflammation. Licorice tea DGL, deglycyrrhizinated licorice, help protect the esophageal lining. Important note: home remedies can help manage mild reflux symptoms. However, if your symptoms are severe, persistent, or do not improve, you need to seek advice from a doctor. Red alert: when to call for reinforcements from the doctor. Don't hesitate to seek medical help if you experience any of the following red alert signs: frequent and severe heartburn and regurgitation that affect daily activities, symptoms that do not improve after applying home remedies and using over-the-counter medications, increasingly difficult swallowing dysphagia, pain when swallowing odynophagia, unexplained weight loss, persistent vomiting, black or bloody stools, signs of gastrointestinal bleeding, severe chest pain, and to rule out cardiovascular problems. Your doctor can accurately diagnose your condition and provide appropriate treatment methods, including prescription medications or more specialized tests, such as an endoscopy, to assess the condition of the esophagus and stomach. Medical weapons to support GERD treatment. When necessary, your doctor may prescribe stronger medications to control stomach acid and heal esophageal damage. Proton pump inhibitors (PPs). These are the strongest class of drugs for reducing stomach acid production. For example, omeprazole, lansoprazole, pantoprazole. H2 receptor blockers help reduce stomach acid production, but are usually weaker than PPs. For example, famotidine, ranitidine. Prokinetics help the stomach empty faster, but are often used less frequently due to potential side effects. In rare, severe cases that do not respond to medication, your doctor may consider surgical procedures, such as fundoplication, to strengthen the function of the LES. Gastroesophageal reflux disease (GERD) no longer has to be a frightening troublemaker if you understand it clearly and apply simple secret tactics at home. Listen to your body. Adjust your lifestyle and diet scientifically, and don't hesitate to seek help from medical professionals when needed. Follow Health Decode to discover more useful tips on digestive health and other common health issues. Click the subscribe button now so you don't miss our next videos. Thank you for being with Health Decode.